your podcast, One Life, One Story, where a special you shares your special story. Today we have Chandni as the guest of the show. Chandni is a doctor, an anesthetist by profession, a mother of a very adorable baby boy, Aryan. Welcome to the show, Chandni.
Thank you so much, Nirmala, for having me here.
Cool. So, Chandni, why don't you start with your journey, your medical journey, and your journey of becoming an anesthetist?
So my medical journey, choosing medicine as my career actually was not tough for me because like my elder sister, she was an inspiration. We are four sisters and out of which we three are doctors.
Wow.
Yeah. So whenever I used to see my sister, I always used to look myself in that position. Whenever I used to see her books, I wanted to read those books. And my parents were always a motivation. Like it was very clear in their mind that Chandni is also going to be a doctor. So there was not a second thought about it. So I started preparing that way. I gave my entrance exam, and luckily I could grab a seat in one of the best medical colleges of Northeast, which is Guwahati Medical College. So that is how my journey began.
Wow, that's beautiful. And that's amazing. In your entire family, your four sisters and three sisters are doctors. That's so amazing.
Thank you so much, Nimla.
I'm sure your parents must be really proud of you all.
Yes, they are.
You get into the medical line, and how did you get into this profession of becoming an anesthetist?
Yeah, so anesthesia as a branch, like after we complete our MBBS, we do internship. So in that internship period of 1 year, we are posted in all different departments for a month or two. So anesthesia was always a short subject, and we had read it very little in our MBBS course. So we were posted there for 15 days. And in those 15 days, like I was so fascinated by this branch, looking people like how an anesthetist could control all the physiological changes of a human body. A surgery is going on, and it is the anesthetist's responsibility to put them to sleep, to wake them up, to take care of their heart rate, to take care of their blood pressure. I mean, I found it actually miraculous. So that is how my curiosity began. And somehow, like in the back of my mind, I always had the desire to become an anesthetist at that time. So after completing my internship, like I started reading, I again gave the entrance exam, and thank God I could grab a seat in anesthesia. So I like just without a second thought, I just took the seat and started my journey as an anesthetist. So this is how I became an anesthetist, or like I started my journey.
Oh, that's really awesome. So this profession or this specialization, as you're saying, anesthetist, to be very honest, I didn't have any clue about it. And I'm sure many of our viewers would also be not knowing about this specialization. And as you are saying, you find it really miraculous. I too actually find it really miraculous the way you are saying. I mean, for me, the perception of, I honestly speaking, I didn't know about it. I didn't know that there is a term called anesthetist, first of all. So what I know is anesthesia. So in that also, you just, what I thought was put an injection and you just collapse and, go to a different world. But the way you are telling, that is actually very amazing. And I would like you to put some light on this profession because it is very interesting.
Yeah, thank you so much, Nirmala. I really want to thank you for giving me this platform so that I can put some light on this branch. So you are not the only one who thinks that we put an injection and the person goes to sleep. This was very surprising for me because many of my friends, they used to ask me, oh, you stay inside the operation theater till the end of the surgery? We thought you just have to give an injection and come back. So I used to think, oh my God, this is how people think about anesthesia. So it is not like that, Nirmala. Anesthesia is a wide branch. So we have different kinds of anesthesia for anesthetizing different parts of the body. It all depends upon the type of the surgery and where the surgery has to be performed. So there is something called spinal anesthesia, in which we anesthetize only the lower part of the body when the upper part doesn't have anything to do with the surgery. There's something called general anesthesia when we put the person totally into sleep. There are something called regional blocks, which we perform on hands and foot when only the hand surgery has to be done. So we, with the help of special gadgets and machines, we localize the nerves, we inject injections over there, and with the help of those things, we put the patient to sleep or anesthetize them. More of it, an anesthetist. So I'll just give you a brief about the role of an anesthetist. So it all begins, So it all begins before the surgery. So an anesthetist, whenever a surgery is planned, an anesthetist has to go and look after the patient, just to give a tick mark that yes, this patient is fit to undergo anesthesia and surgery. Once this happens, we plan the surgery, and inside the operation theater, we take care of all the vitals and hemodynamics. When I say hemodynamics, I mean the heart rate, the blood pressure, the oxygen saturation, then the fluid management, as in like how much fluid has to be given to the patient. There are many calculations for that. We have to look after the urine output of the patient. Then we have to fulfill, of course, the demands of our surgeons. Sometimes in some of the surgeries, they say, oh, madam, I want the heart rate to go a little down. So then we have to do something and bring the heart rate down. Oh, madam, now I want the blood pressure to be a little low. So we have to do something and bring the blood pressure a little low. So this is like, this goes on and on and on until the surgery is completed. So once the surgery is done, we again bring the patient back to the normal world. So anesthesia is something between the earth and sky. The patient is somewhere between the earth and the sky.
So let me interrupt here, Chandni. So you are saying that, before the patient goes for surgery, you have to first check the patient and give a tick mark, as in it's like kind of checklist that you have to see that the patient is fit to go for a surgery, fit to be given anesthesia. So is it correct, or am I taking it correctly if I say that you are playing a crucial role in giving a green signal to a patient to undergo a surgery?
Yes, you have understood it totally correct, Nimala, but then it is a teamwork basically. So again, when we do the checklist, we have to see how urgent the surgery is, how emergency the surgery is. Then the anesthetist and the surgeon in collaboration, if we find some problems in the patient, as in like we feel that the patient, so when we feel that the patient is not absolutely okay to undergo the surgery, we have a word with the surgeon. We discuss how important it is to operate the patient right now. If the surgeon says it's okay, we can wait for 2-3 days. Then we take the time and we optimize the patient, bring him to the level where the anesthetist and the surgeon are comfortable to work with. But if the surgeon says, no, it is very important and we have to take him right away to the operation theater, then we take all kind of risk, and weighing the risk benefit ratio, we take up the patient. It is something like that.
Okay. So when you talk about the risk level, so I'm sure the risk is also again distributed between you as an anesthetist and the surgeon. Is that so?
Yes. It is like that.
Okay. That's really amazing, Chandni, because I didn't have any clue. You can say zero clue about whatever you are telling right now, and that these are like superb.
So you are not the only one, Nirmala. Out of 100 people, 90 people I meet have the same concept about anesthesia.
I myself is very glad and happy that, I brought you here and you are giving me all these kind of lights onto what you actually do. Actually, I interrupted you in between. So you're saying, when you give a patient an anesthesia, the patient is in between sky and earth. So after that, what happens?
So after that, slowly and eventually, we bring the patient back to the normal life. We awaken the patient with the help of certain drugs and medicines which we use. Then once the patient is awake, we again have a checklist to check all the things, whether the patient is absolutely okay or not. And then we keep the patient for observation for around 1 hour or so. And when we are totally confident that yes, the patient now can be shifted, so the anesthetist is like, okay, now I can leave the operation theater. You can take the patient to the ward or shift wherever is needed, and the anesthetist can leave. But then again, we also take care of post-operative pain management. So that also comes under anesthesia.
Okay.
Yeah.
So that means your job doesn't end when the surgery is over. So there are still roles where you need to play in.
The role continues until the patient is discharged from the hospital.
Oh, okay.
Yes.
Interesting. Very interesting. Yeah. Cool. I mean, yeah, it's really insightful and mind-blowing, actually. Now everyone knows the key role and the importance of anesthesia and anesthetist. So this makes me ask you or share, few points or things you would like to share with the medical aspirants, young students who are doing their MBBS, who are kind of thinking of taking this profession, but little skeptical, or people, again into the MBBS line, but not sure about this profession. What would you like to advise to these young people?
Nimala, I would certainly take up this question, but before that, since we were talking about anesthesia, I would just like to add few points. As in, like the role of anesthetist doesn't only limit within the operation theater. An anesthetist also has roles in the peripheries, which means in the MRI centers. When you might be knowing that some people, they are really scared of going inside the MRI machine. Yeah. So in that case, we have to give anesthesia to that patients, and then they go inside the MRI machine for the scanning. So there the role of anesthetist comes. Then an anesthetist is also an intensivist. So we work in the ICU also.
Oh, okay.
Then you must have heard something about labor epidural or painless labors.
Yes.
So there the role of anesthetist comes. It is the anesthetist who give the labor epidurals.
Okay.
Yeah, and there is something called pain management. Simple pain management for different kinds of pain in the body which we have. So that also an anesthetist does. So these are the few different branches apart from being inside the operation theaters.
Wow. So you have different roles within the anesthesia role itself, different branches or different roles altogether, and that's really amazing. Wow.
Yeah. And more of it, we have to have knowledge about each and every subject, because we deal with orthopedic surgeries, we deal with gynec surgeries, we deal with general surgeries, we deal with neurosurgeries, we deal with cardiac surgeries, we deal with pediatric surgeries. So we have to have an overall knowledge about everything.
So yeah, in general or overall, you need to know about all kinds of surgeries also.
Yes, something like a physician.
Yes, absolutely. Yeah. Oh, amazing.
Yeah. Now, Nirmal, I would take up the next question, which you were asking me. So to the medical aspirants, I would really say, if the person is really interested in learning medicine and working as a doctor, then they should go for it. It is a very hard working profession. I mean, like you have to toil day and night. I mean, there are night duties, there are emergencies, a lot. So, but if you feel happy doing that, you should definitely go for it. And as people think that doctors earn a lot of money, so this is a myth. You really have to go very high to earn that much. So you have to be very patient. So that is it.
Yeah, that's a very honest opinion you are giving. Yeah. And I know, I agree with your point that, many people think that doctors really earn a lot. And now this, medical line has become a business. It's like an earning machine. I don't agree with it completely. There are, I would say 20% or 30% gray line is there. There are doctors who are so much money minded. I agree with that. But the rest of the 70% or 80% of doctors and people into this profession, they're still very genuine. And as we all say that doctor is a noble profession and it's about serving the people, and money is a secondary thing that flows in. and as you put it very correctly, that money comes more later when you start, I think gaining that reputation or position. I think that's how it is with the medical line, and you put it very nicely, and especially for the medical aspirant who would like to get into this profession. And that's really superb, Chandni. So I would end this conversation with one last question, and that would be this: being a doctor, being someone in the medical line, what would you like to tell our viewers during this tough time of COVID-19 pandemic?
Yeah. So we all are facing a very, very tough situation. But I believe by now we have become experts in it if we follow it. So by little applying common sense, hand washing, wearing mask, maintaining social distancing, avoiding gatherings. This is the best we can do. And we should do this. Yes, we should work hard on building our immunity so that we can fight with the virus very effectively. And we should maintain proper hygiene. So that is the mantra, and we should follow this absolutely.
Yeah, I agree with you. Hygiene. Yeah,
Yes.
I agree with you.
Yes.
Great. Thank you so much, Chandni, being with you and getting insights about your profession, about anesthetists, about this specialization. That was what would I say? It is like something which I didn't know at all, which I'm sure all our viewers didn't know at all. Wish you all the best, Chandni, and God bless you.
Thank you so much, Nirmala. Thank you so much for giving me this opportunity that I could speak a little about the subject. Thank you so much.
My pleasure. Thank you. Bye-bye.
Thank you. Bye. Bye.